前段时间我看了一部叫《混沌少年时》的剧，深刻感受到青春期的世界有多复杂和冲突。剧中的故事虽然极端，却映照出我们每个人在成长过程中都会面对的来自家庭、学业、同伴、社交媒体等各种各样的压力。而作为一个新手妈妈，我也常常会反思我的养育方式将如何在无形中影响我孩子未来的性格、人际关系，甚至是心理健康。带着这些疑问，我邀请到了一位在美国从业的儿童与青少年精神科医生，聊了聊孩子的情感发展，他们所处的现实环境，以及精神科医生需要经历的成长路径、日常的工作状态。无论你是关心下一代的成长，还是想重新审视自己的长大历程，都希望这一期节目能为你带来一些新的视角与启发。Becoming a parent has been the wildest crash course of my life. There's the sleepless nights, the tiny socks, and then the big sauce. Like, what am I shaping here? How much of who my kid will become is already baked in, and how much is about the world we build around them? I don't have all the answers. Actually, I have way more questions than answers.Which is why I wanted to talk to someone who spends their day helping kids and families figure this out. In this episode, we're not only talking about how kids grow emotionally, the pressures they are facing, but also what it takes to become a child and adolescent psychiatrist, what their work looks like every day, and why it can be such a rewarding path for anyone who loves connecting with young minds. Whether you're a parent,or you are curious about mental health careers, or you just care about the next generation. I hope you'll find this conversation reassuring and maybe even a little bit inspiring. Hey everyone, I'm so excited about this episode. Just so you know, I had a baby a while ago, and it's been a whole new experience for me. And I've been thinking a lot about the long-term impact of everything I do on my little one.One example is attachment theory, which says early emotional bonds with our primary caregivers shape all of our future relationship. But I know there's much more to learn about the impact parents can have on their children, especially from these early days, which brings me to our incredible guest today. And I'm thrilled to be joined by Dr. Sean Jane. He is a child and adolescent psychiatrist.So Sean, thank you so much for being here to help demystify this subject. And could you give us a quick overview of who you are and what you do?
Yeah, thank you so much for having me. I am a child and adolescent psychiatrist, and I currently work for Kaiser Permanente here in San Jose. I did my training at Boston University for my medical degree, and then I was within the Harvard University system for my psychiatry residency, and specifically at Mass General Hospital for my child and adolescent psychiatry fellowship.
Yeah, so my first question would be, what inspired you to go into medicine and specifically child and adolescent psychiatry?
I think from very early on, I've been very interested in science in general. And when I was in middle school, my school took me on a field trip to an exhibit called Body Worlds. I think it's still around, actually. And essentially, it's a bunch of preserved human bodies, and they were dissected to various degrees, and we were exposed to sort of the wonders of human anatomy and physiology. And since then, I think that's when I knew I wanted to go into medicine or study science more. So I pursued that. What I initially thought I wanted to do was pediatrics because in my undergrad, I was a volunteer on the pediatric inpatient floor at Mass General Hospital. And my job there was to basically play with the kids who were there sick and getting treatment. And I really enjoyed the process. And I saw the kids that engaged more with me, who had parents visiting, were able to get well a little bit faster than the kids who were there and, parents who weren't visiting as much and they didn't want to engage with me as much. It took longer for them to get better. In medical school, though, I realized that I didn't want to do pediatrics after all. Frankly, because I think it was just a lot of pressure, because, parents are really, really stressed out. And I didn't want to, disappoint the parents. And I did find my passion in psychiatry because of the sort of unique ability to combine biology, psychology, and social factor in a really deeply and meaningful way. I saw that, I liked how holistic psychiatry is, because you look at the impact of their social lives, their upbringing, and their relationships currently, and how that impacts their health as a whole. And so it became really natural, I think, knowing sort of my path and my past experiences, that, I wanted to do child psychiatry because, I loved working with kids with my experience volunteering. And then I really loved psychiatry. And more importantly, I think, on a more kind of clinical aspect, while in residency, we work primarily with adult patients, in psychiatry. What I saw was, how hard it is for someone to make significant, changes to their behaviors once they become an adult. A lot of the ways that they cope and deal with the world and stressors have been very much kind of cemented. And it felt like, when I was working with adults, I was just kind of trying to slap on Band-Aids onto problems rather than trying to fix the issues that is at its very core. And when I did my rotation for child psychiatry in my residency, I did feel like, kids were more resilient, they were more adaptable, and I was able to see how early intervention could completely change the course of not only their immediate sort of future, but also for the rest of their lives. And to me, that just felt more rewarding.
I see. Yeah, and I know you go along very well with kids, because last time you came my home, you held my baby very perfectly, and she really likes you.
She is very cute.
Yeah, thank you. Yeah, and we all know it takes a long time to become a doctor. So what does the full journey look like to become a child and adolescent psychiatrist?
It starts off with, 4 years of college for undergrad. And then, for me, I went straight from college to medical school. I think it's becoming more and more prevalent where people, have to take additional years in between college and medical school to get additional experiences or education before they enroll. So for me, I did the 4 years of college, 4 years of medical school. And then I, applied and, entered a 4-year psychiatry residency. That I was able to graduate, in 3 years and finished a 2-year fellowship specifically in child and adolescent psychiatry.
I see. Yeah, that sounds like quite a commitment. That's why I always have high respect for all the doctors. Yeah, and you came from a lot of top programs like Harvard and Boston. So was there a course or rotation that really stuck with you, kind of shaped the way you practice today?
I thought about this question a long time, and I think because there's so many years rolled into that question, I think for me it was probably more of the specific clinical experiences that stood out to me, that is very kind of ingrained into who I am and how I practice medicine now. And it's from my 2 experiences working with patients while I was in fellowship. And sort of the way that training goes, how it's structured, is in fellowship we have rotations. And what that means is, for a certain period of time, we have a specific job, whether that's, we work in a hospital on a specific unit that's sort of specialized in a specific disease area, or we are in the ER and our job is to kind of do a more sort of broad diagnostic approach and sort of triage what the next steps are for the kids that are coming in. And at the same time, on top of all of that, we maintain a longitudinal outpatient clinic where we see kids regularly for up to 2 years. And so what really stood out to me during these years of training was how important having someone, whether that's your parents, your siblings, your teachers, a friend, or even a doctor that's just consistently there for them, that's showing up every single week, providing unconditional sort of, support, providing a safe environment for them to kind of express the things that are bothering them, and then hearing them out, and sometimes, offering advice, modeling what healthy coping, what healthy behaviors are. And so for these two kids, they came to me. One was for ADHD that had really significant behavioral dysregulations at home and at school that's really getting in the way of their growth. And then there was another patient that came who had a lot of attachment trauma from when they were younger, and they suffer from abuse. Obviously, when the kids are young, they can't really process all of that, and it's coming out in disruptive ways to their lives. And they're always angry. They're sometimes like more physically aggressive. Then they can be really tearful, hard to console. And so these two kids were the ones I followed for 2 years, every single week for those 2 years. And through play therapy, I know, which we'll talk about later, they were able to get better and better. And, not just what they're saying themselves, but also, what the parents are saying and what the school is saying. I feel like it's not only is it the doctor-patient relationship, but they also see me as a trusted, confidant, like a trusted adult. And I think that's a really special kind of relationship that I look back very fondly on.
Mm-hmm. Yeah, I think from your experience, I also see some personal traits that really matter in this field. For example, I think patience and also empathy and also the ability to connect with young people are both huge ones for your field.
Yeah, absolutely. And I think you kind of nailed that. I think the most important thing when you kind of take away all of the big words like empathy, patience, flexibility, is at the end of the day, can we make a connection with the child, no matter who they are, how old they are, in the span of, an hour, 30 minutes, or even 15 minutes? Because being able to establish that trust, that connection, is what determines whether or not they feel like they can trust you in sort of helping them out. Because, they're coming into the office, I'm a stranger to them, and why should they trust me? And so being able to make that connection is I think the utmost important thing. What helps with making that a connection, I think, is actually just kind of being a child at heart. I feel like we, as adults, we can't be taking ourselves too seriously. There are still things that we might enjoy that people might feel that's childish. I mean, for me, I love playing games, and I think that's one of the ways I'm able to kind of quickly establish that kind of common ground with kids these days. As soon as they know that I know the game that they're playing, or I play the game that they play, they instantly kind of open up, and they're smiling. They're willing to kind of share the things that are really bothering them. They're willing to share and show me their vulnerabilities, and that's really the beginning to a really impactful kind of sort of relationship. But at the same time, being able to have that empathy and that patience and that flexibility is really crucial, because kids can't always express how they're feeling directly, and so kind of being able to kind of see the subtle sort of facial expressions, body language is also really important, helps guide how the conversation goes. Additionally, it's not just the child in front of me that is my patient. I see it more as a sort of a unit, like the family unit, right? And so, I've the parents, I very much collaborate with them, and being able to communicate effectively with parents and collaborate with the schools, the social services, goes a long way. And knowing that, I think also understanding my own limitations in terms of my scope of practice, and having humility is important, because everyone on a sort of interdisciplinary team has different sort of expertise, and being able to listen to what each party has to contribute is really essential.
I see. Yeah, that's nice. I feel you're more like a friend to that family, not just like a condescending authority who's just giving evaluation instructions. I think that's really good.
Yeah, absolutely. I think it's really important to, I feel like there was a time where doctors and medicine was more paternalistic. It's more of like, this is what the doctor said, so this is what we're going to do. I think that has shifted significantly over the past few decades. And now it's much more collaborative. And especially for me, I think I see my role as, I want to give the parents all the information. I want to give the kids all the information so that they can make the decision that most align with their beliefs. I mean, there might be times where I would urge them more so than others on certain treatment approaches, but there's no way I can really force them to do anything or tell them to do anything that they don't want to do. And I always want to kind of try to meet them as much as I can in the middle or where they are.
Wonderful. So bringing it to the present, what does a typical day look like for you working for Kaiser right now?
So I work mainly in a clinic, so that's outpatient. And so I work sort of like a 8 to 5:30 kind of job. During the course of the day, I see some new patients. I see some old patients where they follow up, where I check in on their progress. And at Kaiser, I also am one of the supervising attendings, and that means I help supervise and teach psychiatry residents that are part of the Kaiser Psychiatry Residency Training Program. I also have time to look at applications for people who are applying to the psychiatry residency. I'm also the director at Kaiser for their sub-internship program. And what that means is a lot of times in fourth year medical students, they already know what they want to kind of apply into, like in terms of their specialty. And so for students who are applying into psychiatry, people want to make their application more robust. They want to be more competitive. And one way to do that is to apply for a sub-internship program. And essentially for a month, these fourth year medical students are practicing at the level of a first year intern. And it's very rigorous, and it's also very educational, and it really helps, I think, hone their clinical acumen. And so I run the program. I look through all the applications. I make the selection, and then I help, ensure that the entire process is a rewarding one for the students that rotate with us. And then there are times, I think a couple of times during the year, where I'm also the on-call psychiatrist for the entire hospital. And our hospital actually covers not just San Jose, but we also cover regions like Santa Cruz, Monterey Salinas, Watsonville. And so I field questions, like usually urgent ones. And then for really concerning ones, I also go into the hospital and I see the patients.
I see. Do you ever have to work late or on weekends, or it's just very rare?
So I work on weekends 3 times a week. 3 times a year. What that looks like is I go into the hospital. I round on all the patients that require psychiatric services, and then I see new ones, new sort of consultations that other specialties have for their patients when it comes to psychiatrically related questions.
I see. Yeah, that sounds pretty good work-life balance, because most of the time you will be done by 5:30.
Correct. I can't complain too much.
Yeah, that's good. Yeah, and I also see your focus on conditions like ADHD, anxiety, and depression. So how did you usually diagnose those conditions and plan treatment for them?
Yeah, I think, I try my best to look into their initial referral question. So usually when patients come to me, I already have, they've already told someone in the hospital why they need help in psychiatry. And so I do my best to review the medical records to see if there's anything that could be contributing to the question that they have, especially from a more kind of like a medical perspective. Because we want to make sure that nothing medical is contributing to this, because we want to fix that first before we consider anything psychiatric. Afterwards, once they're in my office, it's a very sort of like a thorough diagnostic process with like both interviews with the parents, with the kids, also getting collateral information from the school. Sometimes we refer them for psychological testing. And then, we would, develop a plan collaboratively with all the stakeholders.
I see. Yeah, that sounds very comprehensive. And do you often need to discuss a case with your colleagues to make sure you're all seeing things the same way?
Yeah, I think, so we call that peer supervision. So, we're asking our peers, who are other child and adolescent psychiatrists, occasionally when there's a really complex case and we just want to hear other opinions, other perspectives on sort of approach to treatment. And it's very similar to the way that supervision is in training, where, an attending supervisor provides sort of guidance to the resident or the fellow, sort of other perspectives in terms of approaching specific cases. And I think it's really important. I want to highlight that, at least for me, I really like the phrase, never worry alone, because when there's something that's when it's very high pressure, when something is really complicated, when a lot of things are at stake, I think it helps to kind of, discuss this with our colleagues, with our peers, not only for help, but also to kind of share some of the, so that they can help share some of the load.
Yeah. And also for treatment, my understanding is that you have medication and also therapy. So how do you usually balance the decision between these two, or they can go together?
Yeah, that's a great question. In general, I think it depends on several things. It depends, one, on the policy of the hospital, the policy of the clinic. There are some places where the child psychiatrists are able to do both therapy and do medication at the same time. And there's no kind of restrictions or stipulations in terms of that. In other practices, physicians are solely responsible for prescribing medication. And then there are therapists whose sole job is to do the therapy part. And it's more of like a division of labor. And I think for me, when they're, at least here at Kaiser, when they're coming to me, they've already been evaluated by a therapist, and they might have already tried therapy for whatever concern they have. And so it's more like they've already tried therapy. Maybe it's helping and it's not helping enough, or it's not helping at all. And they're hoping that, okay, medication might be something that will help push things in the right direction. In general, there are times where I do say, I don't think medication is appropriate. I think this is something that therapy will have a far greater impact on. And then there are times where I think that, medication would be helpful and it will make therapy more effective. I'm always for a combination of, first of all, I'm always for therapy. I think everyone could benefit from therapy, even if they don't have any psychiatric diagnosis. Even you and I would benefit from some form of supportive psychotherapy. And then in our case with child psychiatry, when they're coming to us, and no parent wants to put their kids on medicine. I want to be very clear about that, right? They're usually I am the last person they want to see. I am their last resort. And so I work with parents knowing that, and I make it very clear to them that medication really is meant to be as temporary as possible. And ultimately, it's to make therapy more effective so that they can get more out of therapy, so that in the future, maybe they don't need medication as much. Granted, there are certain disorders, psychiatrically, where medication is required for the rest of someone's life. And I make that very clear at the very beginning.
I see. And is play therapy your favorite?
I think so. And I know we talked about it earlier in the interview. And I think it's something that's very time consuming, but I think it's the most rewarding because you get to know the kids the most and they get to know you a little bit and have this wonderful relationship with them. And you're able to see their growth, week by week, year by year. And it's something that really, I feel like no other treatment modality can really offer. Plus, part of play therapy, there's the play. What does that mean? Well, it's different for every child, right? For some, it means like we're literally playing games. We can be playing board games. We can be playing chess. We might be playing some video games. Video games is a little bit tougher because I think kids become too distracted with video games and they're not able to actually communicate effectively. But I think essentially it's a more fun way of having therapy. And it really kind of helps open the child up. They feel safer, they feel more comfortable, and therefore more willing to share what's bothering with them, or kind of maybe even act out or role play the things that are bothering them, bring sort of more clarity to their pathology. And that way it can help us, like the doctors, the therapists, the parents, the school, to develop a sort of a better treatment process.
I see. Yeah. That is also something you can continue doing at home, right? If the parents have time.
No, I would say no, because I think it's really important. So like the parent's role is very distinct, right? Nobody else can be the parents except the parents themselves. And the role of the play therapist is to be someone that's not the parent. So essentially to be the role of a trusted adult that the kids can feel like they can share things with and feel like they won't get in trouble right away. Like if they share something that they know that the parents are going to be mad about, like with a play therapist, we're not going to be mad at them for the things that maybe their parents will be. And I think that's the key.
I see. So earlier you also mentioned some other roles you work with, like therapists or social workers. And I know there are also like psychologists and maybe other mental health professionals at school. So how do their roles differ from yours?
I think there's definitely overlap in the roles that we have. However, I think what makes me distinct and what makes child and adolescent psychiatrists distinct is that while we can do therapy that like the psychologists or the social workers are able to do, we are the only ones that can make the decision on medication and prescribing medication.
Yeah, and how do patients usually find their way to you? So are they mostly like referred by their therapists or their pediatricians?
It's really dependent on, I think, the insurance they have and what hospital system they have. I think the majority of patients, they have to be referred to us, and there's often a wait list. Like back in the East Coast, the wait list, was from 6 months up to a year to see someone like me. And that's one thing I really do like about Kaiser's model of care is that there is a stipulation that if there is a request to see a child psychiatrist, they have to be seen within 15 business days at Kaiser, which I think vastly increases the access to care for patients. And they don't need a referral to like from their pediatrician. Parents can request to see us directly.
That's awesome. Yeah, and what is the age range of most of your patients?
I think it really varies. We can see people as young as 2 or 3. That's very rare, but it does happen. And I see patients up to 18 or a little bit over 18, depending on their situation.
I see. And what are the most common issues you see in your patients?
I think it's actually very diverse. It's not just like depression or anxiety. I think it's a really sort of well mixed mix of like ADHD, autism, depression, anxiety becoming more prevalent, but less. There's also like substance use disorders. There's also some behavioral disorders. And so I think every day is a little bit different.
Yeah, and are most of these issues driven by genetics or environment or an interplay of both?
Yeah, I think it's almost always both. Genetics play a significant role in development of various disorders, whether that's anxiety, depression, ADHD, autism, psychosis, substance use. Genetics even play a role in suicidality. But at the same time, I think even with certain genetic predispositions to these disorders, there's some kids are still able to thrive while others aren't able to. And that's very much dependent on sort of the environment. And so that's like how the family unit is like. How do parents interact with one another? How do they interact with their kids? Are they getting bullied at school? Is there too much academic pressure? Have they had like a history of trauma with like parents divorcing or they've been abused? Things like that.
Mm-hmm. Yeah, and also I read that it seems anxiety and depression have become a lot more common among kids since the COVID-19 pandemic. Did you see that as well?
The short answer is yes, but I feel like the answer is more complicated because at the same time, yes, we are seeing more kids being diagnosed with anxiety or depression. This is also an age where mental health and the importance of mental health is recognized. And there's a greater effort to sort of screen for kids who may be vulnerable to depression and anxiety. And so I think naturally, in terms of just pure statistics, the more we screen, the more likely the more likely there's going to be, positives on these screening scales. And so potentially there could have been all this depression and anxiety before, but they were masked by other things. And I think maybe COVID was like sort of this unique event that kind of unmasked a lot of the anxiety or the depression that kids had, because they didn't have access to sort of the socialization, maybe sports, the school environment, that helped them cope with depression and anxiety. And all they had was, Zoom school and staying at home all day and just being on their screens the whole time, being more exposed to certain contents on social media, that could predispose them to be more anxious and depressed. I think there's that simple answer, but then there's a whole lot more that contributes to it.
Yeah. Is it also because mental health is discussed more openly in public right now, so kids might be more willing to going out and seeking for help?
Yes, absolutely. I think there's always that stigma about mental health, especially us growing up. Like you and I are a similar age, and I think at that time, I think mental health is very much taboo. And depending on the culture, there's an additional added layer of taboo. I think now here in the United States, there's more openness and acceptance for mental health. And so people are more willing to speak up and ask for help.
And so for your patients, are parents usually the one who make the call to bring their kids in, or do you see a lot of kids coming on their own?
A majority is parents or the school telling the parents. A very small number are driven by kids who want to come in. And generally those kids are like, older teens.
I see. And you work on both the East Coast and the West Coast. Have you seen any difference between the two regions in terms of patients or the insurance or the support systems?
Yeah, I think, each region, no matter whether it's the East Coast or the West Coast or the Midwest or the South, I think has unique sort of environmental as well as genetic makeup. And all that can contribute to sort of different prevalences of disorders. And it also depends on the setting that you practice in. And so I think there's a lot of confounding factors. So like on the East Coast where I did my training, I worked in more high acuity hospitals, locations. And so the patients I saw, and whereas on the West Coast, I'm working on an outpatient setting. And so kids in general who are coming to me, they're not sick enough to be in the hospital yet. And that in itself, I think, is a distinction. But in terms of just like, I think culture, both locations, I think we see, stress-related, disorders-related, for high-achieving youths on both sides of the coast. We do see more on the East Coast. There's sort of more like urban poverty and trauma, just because of the practice setting. I've only practiced in urban settings and on the East Coast, but on the West Coast here, although San Jose is a city, the hospitals, in catchment area includes a lot of sort of suburban and even rural communities, and that in itself, I think, shows it's like just a different sort of patient population, and they obviously have different needs and different concerns.
Yeah. And do we have enough child and adolescent psychiatrists in the country?
No, we don't. And I think that contributes to why, to see a child and adolescent psychiatrist outside of a place like Kaiser, one would have to be on a wait list for, 6 months up to a year.
We need more people like you. Yeah. And so if you're not doing the clinic, what are some other career paths can you pursue?
If I'm not doing what I'm doing now, I think my training at Mass General really kind of makes me confident in taking on any kind of role within psychiatry and child and adolescent psychiatry, whether that's outpatient, working in the ER, working on the inpatient psychiatric floors, working in one of the sort of residential level of care, or like intensive outpatient, partial hospital. Any of these different roles and acuities, I would be comfortable doing. Did you mean that, or like outside of medicine?
Yeah, because I imagine like you can also like work with schools or even courts to provide some like assessments for those institutions.
So there are certain schools that do have like a child psychiatrist on staff. For the court, it's forensic psychiatry. And so you would typically need to have some form of like forensic fellowship training, and that's another year of additional training. So I would not be able to do that. I wouldn't feel comfortable doing that. And then for the school, I think the jobs there's not a lot of it because it's not financially feasible for most schools to have a child psychiatrist on staff.
I see. So after a work day, how do you take care of your own mental health? What would you like to do to help you unwind?
Typically, when I come home from work, I enjoy spending a lot of time with my partner, whether that's just like, eating together, watching a show together, playing some games together. Basically, I like to kind of keep my work and my personal life pretty separate because I think it's really important to have that kind of boundary. And so doing anything that's not related to medicine would make me happy.
Yeah, that makes sense. Yeah, but it's still important for doctors to stay current. So I assume you also need to follow some journals or books or podcasts just to stay up to date.
Yeah. So I think the biggest one is there's the Journal of the American Academy of Child and Adolescent Psychiatry. I think that's like the most important one. And so I subscribe to their journals, articles, and I read up on the latest research. And then I think there are books that I try to keep up on. That's not just good for me, but good for any aspiring parent as well, and even teachers. And obviously, what I talk about is just, my own opinions, not like Kaiser's, and I'm not sponsored by any book companies. But I think the series of like how to talk so kids will listen and listen so kids will talk. I think that series of book, is really, really helpful when it comes to sort of just approaching kids in general. Because kids at different age stages, there's going to be different ways of, talking to them, different ways of listening to them that makes it meaningful for them so that they can feel heard.
Yeah, I will definitely check them out. So are there any emerging trends that you're worried about or hopeful about?
I think like most people, I'm a little bit cautious about like social media and sort of the reliance on screen and the being kind of dependent on digital content in general. I think it is certainly, while it can be really helpful, I think, to help de-stress, whether that's video games or, some doom scrolling is probably good, but too much of it, which is, I think, happening too much. And also bullying is becoming more and more sort of digital too. And that's, kids aren't safe from bullying, not because, before it was just at school, but now it can be anywhere, anytime.
Yeah. Speaking of bullying and social media, it reminds me of the Netflix show, Adolescent. I'm not sure whether you watched that. Yeah, it's basically about the influence of social media and also the toxic masculinity on teenagers.
Embarrassingly, I'm terrible at pop culture, and that's one thing that I think is an area of improvement that I can have, and so that I can stay more current on these shows and TVs and movies.
Yeah, because actually I think your area is a popular topic in the media. I think people are kind of like curious and fascinated with it. Yeah, so how about AI? Are you ever like worried about that it might replace part of your work, or do you think that human connection with the doctors is just irreplaceable?
Yeah, I think AI has a lot to contribute to medicine and psychiatry as well. AI is being used right now in my daily workflow. It helps summarize the appointments. It helps create documentation. And I think it's made my life easier. And it allows me to focus more on the human interaction aspect that you just kind of talked about. I don't have to worry about typing things anymore. I can actually worry more about, I can focus my attention on the patients themselves. I'm not sitting behind my computer. I'm sitting across from them. I'm playing with my patients. And I think in terms of replacement, I think the human mind is beyond complicated. I think AI does really well when there is a set algorithm sort of to follow when it comes to treatment of certain diseases. And AI can probably help make some of those decisions based off of the symptoms that the patients report. However, what AI, at least the AI now, might struggle with is that human connection and making that establishing that trust that will get the patients to share the information that would guide treatment. So we'll have to see.
You were in the Bay Area for a while, and how are you liking it so far?
I think it's a very different location, and I think that the thing I love about the Bay Area, especially South Bay, is sort of the food culture here. Even though I grew up in America most of my life, I feel like my palate is very much still Chinese and Asian in general, and so I love the much more authentic cooking here in the restaurants of South Bay for Chinese cuisine or Korean cuisine than there is on the East Coast.
Mm-hmm. Do you have any place to recommend?
So right now, my partner and I, we like two places. One is, I think, Chongqing Noodle. It's in, is it in Fremont? Oh, it's in Newark. That is the most authentic, Chongqing, noodle that I've had anywhere outside of Chongqing. And then we've also been eating this place called Ping Bistro. It's like Yunnan cuisine, and they have several chains. I think one, it's really spicy, and then two, I think I love sour and spicy things, and they do it very well.
Yeah, I will try them in the future. And do you think the West Coast is also good for like getting some outdoor experience? Like there's so many national parks and also trails in the area.
Yeah, absolutely. I think the great outdoors is much more better here than on the East Coast. There's like mountains that I can just look out the window of my apartment and I can see them, and then you can just drive there and climb it. And we haven't had the opportunity to explore as much, but that's definitely something that we're hoping to do more as we stay in the region.
Yeah, so my last question would be, if you were not a psychiatrist, what do you think you would be doing today?
That's a great question. I think, okay, if you asked me this question before I was a doctor, I think I would have told you that I probably wanted to go, like, maybe just, like, make a bunch of money. I think knowing what I know now, I might want to be like a lawyer or something. Because I think, with psychiatry and law, at least with like litigation, I think there's certain similarities, and it's really important to be able to communicate very effectively and being able to kind of read the room, be empathetic. And I think that like a lateral transition is not sort of the biggest sort of change. And there are instances where doctors are both lawyers.
Cool. Yeah, I think that's a very insightful conversation. Thank you so much for sharing your expertise with us.
Thank you for having me.
And also, a lot of things feels very timely for me as a new parent, and I will definitely carry it with me throughout motherhood. Yeah, so for our listeners who would like to know more about Sean, I will also include a link to his bio in the show notes. And thank you all for tuning in. Take good care and see you next time. 好啦，这就是本期节目。想要认识更多斜杠青年，欢迎你在小宇宙、喜马拉雅、苹果播客等平台订阅关注斜杠青年研究所，也欢迎你把这档节目推荐给你的朋友。